Welcome everybody to the Kvara podcast, where we talk about anything related to pregnancy and the postpartum period. We're going to have a slew of guests from various different specialties discussing all different topics. Tune in and find out. Welcome to another episode of Kvara podcast. For those of you who are joining for the first time, I'm Dr. C. I'm an OBGYN in Southern California, and we have a very, very special guest here today. This is Kristi Waddleton, and I'll let her talk about her credentials and why she's here.
Hi, my name is Kristi Waddleton. I'm happy to be here with you, Dr. C. I am a doula and a certified prenatal yoga instructor.
Well, welcome. Thank you so much for taking the time out of your day to do this. We're so excited to have you.
Thank you.
For those of you who don't know, can you explain what a doula is?
Yes. So a doula is hired to be a physical and emotional support system for you during your pregnancy, during labor, and a little bit after postpartum, unless you're hiring a specialized postpartum doula. So that's kind of their role.
Right. And super, super helpful. And the reason that we decided to do this topic today is many of you don't know, doulas used to be an out-of-pocket cost. And many doulas can be super expensive, but that's because of the great care and support that they provide, during the pregnancy and during labor especially. I've seen many of doula and labor and delivery unit, and they're super, super helpful. But what's really amazing is that most states, eventually all states, but in California, insurance companies are actually mandated to pay for doulas now, which is amazing. So all patients will have access to a doula for no out-of-pocket cost.
That's great.
So, for many of you who will now have this access to an amazing service, let's talk about what it is that you'll be getting. So for a patient that is pregnant, you have several visits in the office with a doctor, midwife, whatever route you choose. You now have access to an amazing doula. Tell me about what service it is that you offer in the office and how you will help throughout the pregnancy.
Yeah. Well, so a doula will get to know a patient and see what her needs and wants are for the whole process. What kind of guidance does she want during her pregnancy? What kind of help can you give her during that time? And then given a birth plan. So talk about a birth plan and what you were expecting at the hospital to happen during labor and delivery. And then upon labor and delivery, the doula is there as an emotional and physical support for you, for your birth partner, for anybody else in the family that may come into the room, and as well as nurses and doctors. We work together to make sure that it's cohesive and it's comfortable and it's a really successful birth.
Amazing. And I'm happy that you said that, because a doula, nurses, doctors, midwives, whoever's part of the team, we are all equal members. We just have different jobs. So I'm really glad that you touched upon that. And I'm really a big fan of having doulas help out throughout labor, because it really is amazing. Now, you mentioned something that is, I see very commonly, and maybe it'd be nice to kind of talk about that and kind of guide patients as to what to think about. You mentioned birth plans. What kind of things do you kind of talk about patients and guide patients on how to make a birth plan, and what kind of things that should they be thinking about?
Absolutely. So, a mom has in her mind what she's going to have her labor look like. She's going to have twinkly lights. She's going to have music.
Right.
And so she's going to have those things in her birth plan. Yeah, I want the lights dim. I want the certain music. I want certain fragrances. I want touch. I don't want touch. I want an epidural. I don't want an epidural. And a doula's plan is to help, facilitate that as an advocate during the labor process, because she may not, mom may be in labor and not be able to speak up for herself. So that's the job of the doula, to look at the birth plan and say, actually, she wants to talk a little bit more before she's doing this or that.
Right.
And to know that it's okay to stray from the birth plan, because baby's best interest, mom's best interest is always in mind. And so if all of a sudden we're getting an emergency C-section, that's not on the birth plan. Let's talk about this. This is for everybody's health and safety. We're shifting gears, and that's okay.
Right. Totally okay. And I'm really glad that you mentioned that, because it is really nice. It's nice to go into a labor and kind of know what you want. Dim lights, music, candles, incense, that's all amazing. And I do really encourage it. This is, your process. This is your birth, so I want you to have it how you want it. But the most important thing, I'll tell you what's on every midwife and doctor's birth plan, is a healthy mom, healthy baby. All of the other stuff is a bonus, and you will learn very quickly, especially if this is your first baby. Babies, you can make a plan, but they will always stray from the plan, right? And hopefully it's reassuring to know that, our birth plans at the hospital or wherever you may deliver actually most of it matches your birth plan. Some of those things are, delayed cord clamping. That's something that I'm sure that you talk about. It's part of our birth plan. It's actually pretty standard of care now.
That's great.
Yeah. Skin to skin. That's something that commonly comes up on birth plans. And, I know you agree.
Yes.
And we all agree. It's very, very common. Now, you did mention the C-section thing. It's actually pretty rare. Trust me. I don't want to offer a C-section as much as you don't want one, right? But again, going back to the healthy mom, healthy baby, it's always what's in best interest of the patient.
Absolutely.
So do you help patients map out these birth plans and in the office, or when you first see a patient in the office, what kind of things do you get to know about them besides kind of their wants and desires?
Yeah, no, exactly. They want to know what is going to be in store, what my hours are, what my certifications, experience, fees, all of those things.
Right.
And just, it is, you mentioned kind of like a matchmaking at one point. Like
Right.
It is kind of a matchmaking. You kind of know right away, oh, this person's going to be for me. I'm really going to understand their energy, and that will be really comforting to me. So yeah, it's interviewing the doula is getting as much information out of them as you can to make yourself, feel like, oh, okay, I have somebody who's qualified, somebody that can really, help me step into this labor and delivery process.
Right.
So.
Right. Do you find it the most important thing when you're matching with a patient is personality, having commonalities there, or is it having commonalities? I'm sure you have had your own birth plans, having had children. Where do you find, or how do you choose a doula? How would you recommend choosing a doula?
I definitely think it's about personality. Some people may want a more tender, soft person that's more nurturing and giving. Somebody might want to say, I need somebody who's going to be like a really strong advocate for me. So I need someone who's like a little bit more strong, that way. So yeah, I think that's definitely personality.
Right. And that's really important. And we bring these things up because you're going to have this opportunity here very shortly. And that's really exciting. At what point in the pregnancy would you recommend that a patient kind of reaches out and tries to find a doula that best fits them?
Yeah. So about your second trimester, you should start to, interview doulas and see which one is a good fit, and start to just get to know what they're like, what their personality is like, and if that will mesh with you. So that will give you time to interview several to see which one will work out.
Yeah. And you can start working on your birth plan anytime, right? Just start thinking about like things that you want. And I know we mentioned earlier, babies don't always have a plan. They don't always like to follow your plan. Yeah. And that will continue until they're 20 years old, right? So just don't be so set on it. I promise you, many of my colleagues, a lot of midwives, a lot of docs I work with, the nurses I work with, certainly, of course, the doulas, we will all read your birth plan and try to follow it to a T.
Yeah.
Not all doctors are these evil, people that we warn you of, and we just want to rush you to C-section. I promise you we'll follow your birth plan. We may deviate a little if we see baby showing signs of stress or something else pops up. Because pregnancy, there's a lot of things that can happen in pregnancy. Most of the time, kind of my mindset is that, you don't need me. You're more of a use than I am until something kind of goes a little bit awry. I just kind of help bring it back in. That's really my job. So I'm really happy that, California and other states have finally come to their senses, and insurance companies are bringing you on the team because it's the most important thing.
Absolutely. Education and advocacy is like so important. And sometimes you can research as much as you want on your own, but until you have someone who's done the research and can advocate for you, because here's the thing, when you're in labor, you're in pain or you're sleeping, you're not always aware of what's going on. And so just to be reminded, or, hey, we didn't actually talk about this. What is this?
Right.
Just to get that knowledge appeases mom and makes her feel a little bit more at ease about the situation. So so being ready for anything that has to take a sharp turn is super important.
Right. Amazing. And I'm actually really happy that you said that, because you're right. I've noticed, many moms, it's a long process sometimes. It can take a day, 2 days at times, right? And you're going to want to take naps and rest, but it's really reassuring to know that you have somebody on your side that has known you throughout the pregnancy. You know the ins and outs of what she and, partner wants, whether that's husband or wife, what the team wants together during the labor process. And if you can advocate for her while she's taking a nap, maybe while she's not really so coherence, with the labor process, it's really, really reassuring. And I'm glad that you brought that up because, you're just an extension of her. And that's amazing. That's amazing.
I like that, an extension.
Yeah, that's amazing. Like you mentioned earlier, we're all one big team, right? And we could try to follow that birth plan to a T. How would you encounter a situation where maybe the nurses or doctors kind of have to veer off of the birth plan a little bit? Kind of how would you approach that with your patients and, make them feel comforted while at the same time knowing it may be a little bit different than what you really wanted?
From the prenatal period, I will also give education to them. So I will give them evidence-based education on what to expect in the labor and delivery process. So when they do go into those situations, they've already had some knowledge about, okay, this is what an epidural is. This is what a C-section is. This is what it means if I'm hemorrhaging. That's the fear taking out of the process helps and invaluable to ease the mother's mind, the family's mind, and then the doula just says, remember we talked about this.
Right.
This is what this means, and we're not going to be fearful because the doctors are amazing. They are, making sure your baby's safe, and
Right.
This is the route we're going.
Right. And that's super important. I'm glad that you mentioned that. We kind of, it's really important to be on the same page right from the beginning. Mm-hmm. Here's the things that could happen, right? We may not want medication, or we may want these certain things after delivery. But there are these weird outliers where you might have a little bit of bleeding. Our job is to make sure that you're doing well and things are safe.
Yes.
Right? The most important. Now tell me about, okay, we get through the pregnancy. We're in labor. Okay. In the room when you're with the patient, you spend the entire labor with the patient, or what does that look like?
Generally, as soon as she says, I'm ready to go to the hospital, and the doctor has said, yes, yeah, you better go over there.
Yeah.
I head over. I got my bag of things that she wants to use that we've already talked about that's in the birth plan.
Right.
And I show up at the hospital, and I'm there to say, okay, where are we at? And what do you need? What do you need from me right now? And so sometimes it's just comfort measures. It's massaging low back. Maybe she wants a foot rub. Maybe she needs some more ice chips. I'm there to give positive affirmations, remind her to breathe, stay calm. Sometimes dad has been there for a minute. He's kind of like, he needs to go get, a breath of fresh air or something. I'm there to just go, Dad, that's okay. I've got it from here.
Right.
Or maybe they have little ones. The sitter hasn't come yet.
Right.
Dad needs to handle that. So I'm there to kind of just facilitate whatever mama needs, but mainly just to be a comfort, just to be like, follow her lead. What does she want out of the process?
Amazing. So you're there for dad just as much as you are for mom.
Absolutely. Absolutely.
Super, super important, right?
Yes.
Can you tell me a little bit about some of the breathing techniques that you kind of talk about?
Yeah. So I love visualization and breathing. So I do in yoga what's called an ujjayi breath. So it's just very diaphragmatic, very calming. It activates the parasympathetic nervous system.
Okay.
And so mama has already maybe thought about visualizations. I do that in my prenatal yoga. And so just, thinking of something that's calm, having an affirmation like, I'm strong, I've got this. And then incorporating the deep breathing all kind of goes together. So
right. And what'd you call the breath?
It's called ujjayi.
Ujjayi?
Mm-hmm,
is that something you can demonstrate?
Absolutely. So if you take a deep breath in, you'll feel like you're fogging your glasses. So you go, and then as you inhale, it's the same light whisper. And then eventually you seal your lips and move that in and out of your nose. And it actually activates your parasympathetic nervous system because it's activating diaphragmatic breathing. It's amazing.
Okay, awesome. So this is something that you will use in labor, and it's commonly used in your prenatal yoga, which
absolutely
we certainly will talk about in another episode.
Yeah.
Well, that breathing technique is amazing, and I can't wait to talk about it in yoga, and I'm glad that you demonstrated it for us because I've actually never even heard of that. So it's, there's things that you learn with a doula that are amazing. Now, you mentioned earlier, we talked about birth plans, right? And having no epidural or no pain management, medical pain management on there is very, very common. Now, what are some techniques that you can help a patient with if that's what they opt for? Yeah,
absolutely. So just reminding them to breathe because, when you breathe calmly, the pain, is a little lessened or, focusing your mind a little bit more on the positive and the affirmations we talked about, but actual physical hands-on, like pressing her hips or massaging her low back or taking the sling and kind of alleviating the pain off of the stomach and rocking her back and forth. So there's physical ways that you can help with comfort measures. And it's a little bit of a distraction too, right? So when you're getting like a foot rub or something, you're kind of maybe not thinking about the pain as much.
Right. Absolutely. And there are some things in the hospital. Most hospitals have, at least anywhere I've ever worked, we have these kind of birthing balls. And a lot of patients kind of really enjoy different position changes. When you have no epidural or medical management, you can kind of roll around on the ball and get into different positions. And it does really help in my experience, seeing these kind of things. Okay, amazing. So now when, we go through the labor, our patient's ready to push, ready to have a baby, what are some ways that a doula helps there? Because I'm sure dad is either passed out, nervous, he has to go take a seat so he doesn't fall down. What ways do you help there during the birthing process?
Yeah, just keep encouraging her. So whatever she needs, if she still needs me up by her shoulders, if she needs me down, going like, we're almost seeing the head, just keep going, keep breathing, It's amazing when you tell them that they're almost there. You can see the head. They're just so encouraged to keep going. So just to continue being a coach, a cheerleader.
Right. I love that. A cheerleader. And that's amazing. And you're an amazing support person. Now we go through this whole process and your job doesn't end there. It doesn't end at just pregnancy care, delivery. You even carry over into postpartum, right? Most doulas do. And then you have even some specialized doulas that only do postpartum. So it's really nice, especially for a first-time mom, right? They carry out 6 weeks, 8 weeks. You're there for the ride. Yeah. So tell me about some things. How do you support a mama postpartum? And what are some things that you're doing for her?
Yeah, so still emotional support because just had baby, floods of emotion and hormones all over the place. So it's still just being that emotional support. And then if she's starting to nurse and she needs help with lactation consulting, I'm there to help support that process. And if she chooses to have placenta encapsulation, that's something that's on the side.
Right.
But yeah, just being there for her until she's ready for me to go home. And then I follow up with a visit a few weeks later and same thing, just kind of see where she's at. I'm always, from the minute I'm hired, available, phone calls, emails, texts, all those things.
Amazing.
So I'm always a support for her. And the more specialized postpartum doulas will actually make nourishing meals, come clean, come take care of children if needed, run errands. Mamas should be very careful leaving the house, especially if you've had a C-section. If you didn't know you were going to have a C-section and all of a sudden you did, that doula is there to come, help facilitate with those things.
And this is actually kind of why I started the whole Kvara thing in general. It kind of blows my mind that, we provide all of this care throughout pregnancy, through labor, right? Especially for a first-time mom, it hits the hardest. After 1 or 2, you have some experience.
Yeah.
But for the first time, right, you have all of this care, you deliver, you go back home and you don't see a provider for 6 or 8 weeks.
Right.
And it's not like you just had a baby. Everything changes, right? The social side of things change, right? Your relationship status changes. You now have another human to take care of, right? Financially, things change. You mentioned the hormones of pregnancy. That changes immensely. The hormones of pregnancy come down. Things like blues and depression, all those things really pop up. How to just care for your day-to-day needs. All of these things change literally overnight. And these poor moms are at home not knowing what to do, not knowing even how to tackle the newborn baby that they have, let alone all of these other things. So I'm so glad that, you all provide this service because it really is needed. And hopefully this podcast and our service, will close that gap and really kind of provide the care that really is needed. But since this is so new to most moms and, you're now going to have access because insurance pays for it, right? Before, it might have been hard to find you, whether either you have your own website, a mom has to search on Google and reach out to you directly and used to pay you directly. But somebody out there might be asking, how do I get in contact with a doula? Well, at least here in Southern California, hopefully very, very soon, is our company. It's called Kvara, powered by Doula Access Collective. We actually have a whole agency of doulas. And once we partner with your clinic, which many clinics will be partnering with us, we will provide a whole doula agency, right? So you'll have a pool of doulas to choose from at each clinic. It's going to be a one-stop shop here very shortly. hopefully by the end of the year, you'll have access to that. Of course, you don't have to use our agency, but, like we mentioned, you can Google to find doulas. I mean, I'm sure people would want to know more about you, right? So where can we find you and where can we find your services?
Yeah, I'm at lavenderlotus.yoga, and you can find my services on my website.
Amazing. Is there anything else that you'd like to discuss that you think is important for, moms wanting a doula need to know before?
I mean, I think that having a doula just there to be a listening ear, to give advice, to provide education, exercises, it's important to exercise during your pregnancy, and also to connect you to the community. So you may not know that, everyone's doing pelvic floor therapy in their pregnancy. They're not waiting to have baby. That's important. I need a massage. Who's certified to do that? So I'm also a conduit to help her in her community find people, find groups, find lactation groups, find mama walking groups. Like you mentioned, when you have baby, it's important to have a support system after. So just to carry her all the way through. Right.
Super amazing. It's almost like you're a liaison for the pregnancy. Absolutely. In addition to like a coach, a support person. And it's funny, I'm glad you mentioned that. This wasn't even prompted. You talked about pelvic floor therapy. On our last few episodes, that's what we had as a pelvic floor therapist.
Amazing.
So it really is amazing. And it's funny how it comes full circle. These things are so important and completely underutilized. But hopefully going forward, now that these things are all going to be paid for, we really can kind of make pregnancy, labor and delivery, and postpartum much, much easier for moms. And, we're going to kind of plug into our next episode. You didn't mention exercise, which is so, so important throughout the pregnancy. It'll actually make your labor much easier. It'll make the pregnancy easier, but we're really excited to have you back, if you will.
Absolutely.
Kind of I know you are really passionate about yoga in general, but you have a special certification in prenatal yoga.
I do.
So that's probably going to be a really long, fun episode. So we'll have Kristi back for that. Thank you so much for taking the time to come here today.
And thank you for having me. It's been a blast. And thank you for all that you do for all the mamas out there. I know that you're amazing. And
Of course. Well, again, thank you. And stay tuned for next episode.